When we begin to discuss patient-family educator from the perspective of the theory of self-care of chronic illness, it's important first to discuss the role. The role would be to educate patients and their families regarding the requirements and responsibilities in caring for themselves and or their family member with HIV/AIDS. We have goals that we like to accomplish during this education session, which would be, what are the goals of the session? What does the educator hope to accomplish? The outcomes. We would want to know, did the patient and or the family understand what was discussed? That is very important. Were their questions answered? Another important factor. Evaluation. How can the educator determine if the education session was effective? So what we want to do is discuss what we like to accomplish by the end of the education session. One, we like to discuss the patient and their families will be able to identify infection prevention measures. What that would be, that would involve the evaluation method, which would be a teach-back method. As the educator, I would discuss what is expected of you when you are at home as far as infection prevention measures such as hand washing. So I would require the patient and or the family to discuss hand washing with me and or reenact a hand washing session. That way I know they are doing it effectively. Another, by the end of the education session, the patient and their families will be able to recognize which clinical manifestations require further medical evaluation. Things such as new onset weight loss, new onset nausea, new onset night sweats, all of those are very important to address. While the patient may not feel it is essential, the medical team may feel differently. So what we want to be sure is that the patient understands and or the family that they need to explain and or tell the medical team any new onset symptoms, whether they believe it's important or not. The third, the patient and family will understand the importance of initiating and completing the necessary treatments for HIV/AIDS and its clinical manifestations. What that entails is medication compliance. We want them to initiate new medications if needed and or continue the medications that they were currently on. This is important for them to understand and know that compliance is essential to their health status and their medical status as well. And finally, the patient and their families will have access to the resources they need in order to be able to effectively manage and care for themselves and their loved ones at home. What that would be is a resource list that would be provided to them, minimum of 5 resources that would include things that would fit their current needs, such as if they need medication assistance programs, dietary consults. Those things, if that's what's needed at that time, we want to provide a resource list to them. That way they have a hand in managing their own care at home.